sometimes we get very anxious couple rushing into our chamber and asking, Doctor, should we undergo IVF? Not every couple who comes into our chamber needs an IVF treatment. There are certain set of indication where we suggest IVF to the couple. First is if the lady's fallopian tubes are damaged or blocked. This is the one indication when we should suggest IVF or they need to do IVF. Second common indication is if husband semen parameter are below normal. That means their motility is very low or count is very low. Third indication would be if husband doesn't have a semen in ejaculate, sperm in ejaculate, but through needle or by surgical process, if we are able to take out the sperm by TISA or PISA, such sperm should be used only by the method of IVF and ICSI. This is the another indication. Nowadays, most common indication what we find out is advanced age of the female partner. As more and more people are pursuing their education, getting married late or want to conceive later, we are receiving many girls who are more than 35 years. In such patients, if they are not conceiving by other means, we decide for IVF very early. And another major category is unexplained infertility. That means where even after 3 to 4 cycles of IUI, the couple is not able to conceive. These are the one who should go ahead for the IVF. Sometimes for some reason we need donor eggs. These are the patients who will get pregnant by the IVF. One more important indication in today's scenario is, suppose if we have a genetic disease and we want to check the embryo before conceiving, whether should that embryo has that genetic disease, we can check it by the method of PGS or PGD. Such cases also needs IVF because for to do PGS or PGD, we need to make embryos. So these are the another indication for doing an IVF. Then those who have endometriosis, grade 3, grade 4 endometriosis patients also needs IVF. If a lady has patent tube, if the husband semen parameters are normal and there is no other medical condition where we need an IVF, the couple even can undergo IUI. Then one more important indication nowadays happening is fertility preservation. Suppose a young lady diagnosed with a cancer and she is due for her chemotherapy or radiotherapy. So to preserve their eggs, they undergo IVF, or if she is married, they undergo IVF, ICSI, make embryos, and we freeze the embryos for the futures. So these are the common indication where we suggest IVF to the couple.